What if I told you that high blood pressure in healthy women is often not caused by salt, laziness, or just getting older, but by a quiet internal shift that almost no one explains clearly? And what if correcting it does not require extreme diets, intense workouts, or adding another pill, but understanding one key signal inside your body? After age 40, many women begin to notice subtle changes. The numbers at routine checkups start creeping up, not dramatically, just enough to raise eyebrows. What makes it frustrating is that nothing obvious feels wrong. You eat reasonably well, you stay active, you take care of yourself. Doctors often say it is a normal part of aging, but research shows something more specific is happening, especially during hormonal transitions. In this video, I will walk you through 5 overlooked internal triggers, ranked from least to most powerful. And the final one is the piece that changes the entire picture for many women. Number 1. Constant insulin stimulation. Most women were taught a simple equation: high blood pressure equals too much salt. So the natural response is to cut sodium and clean up the diet. And yes, salt matters. But in many healthy women, especially after age 40, blood pressure is not primarily a salt issue. It is a signaling issue. Insulin is usually discussed in the context of diabetes. What rarely gets explained is that insulin also influences blood pressure. Every time insulin rises, it sends instructions to the kidneys to retain sodium, to the nervous system to stay slightly activated, and to blood vessels to maintain their tone. That response is designed to be temporary. Insulin rises after a meal, does its job, and then falls. The difficulty begins when it never fully falls. Frequent eating, liquid calories, late evening snacks, even well-intended healthy grazing can keep insulin mildly elevated throughout the day. In midlife women, natural shifts in insulin sensitivity make this effect stronger. When insulin stays elevated, the kidneys continue holding sodium, circulation volume increases, and vessels do not fully relax. Over time, that steady internal pressure becomes your new baseline, and on paper, it looks like unexplained hypertension. Number 2. Estrogen decline and vessel stiffness. One of the most powerful protective forces in a woman's cardiovascular system is estrogen, and most women are never told how much quiet work it has been doing for decades. Estrogen supports the production of nitric oxide, a compound that helps blood vessels expand and relax. It keeps arteries flexible, responsive, and able to adjust smoothly to changes in circulation. During reproductive years, this protection is active in the background. You do not notice it, you do not feel it, but it is there. As estrogen gradually declines during perimenopause and menopause, that protective cushion weakens. Arteries do not become rigid overnight. The change is subtle. They simply lose some elasticity. When vessels cannot relax as easily, pressure rises to push blood forward. Large population studies show that rates of hypertension increase sharply in women after menopause, even in those who maintain a healthy weight and activity level. This is not a discipline problem. It is biology adapting to a new hormonal environment. What makes this frustrating is that everything else may look unchanged on the surface, but internally, the vascular system is recalibrating to a different hormonal setting, and this is only part of the picture. Number 3. Chronic sympathetic nervous system activation. There is another pattern often seen in healthy women with elevated blood pressure, and it does not show up on standard lab panels. It is the nervous system. Many women live in a state of quiet vigilance. Not panic, not obvious anxiety, just constant responsibility. Family coordination, work demands, aging parents, mental checklists that never fully shut off. The body interprets that ongoing load as a signal to stay prepared. When the sympathetic nervous system remains slightly activated, even at low levels, heart rate runs a bit higher, blood vessels maintain more tone, and stress hormones such as cortisol and adrenaline circulate more frequently. Over time, this shifts resting blood pressure upward. Research has shown that chronic psychosocial stress, correlates with higher hypertension risk in women, particularly during midlife transitions. The effect is gradual. It builds slowly, which is why it often goes unnoticed. What makes this complicated is that many high-functioning women appear calm externally. They exercise, they eat well, they manage everything. But internally, the nervous system rarely receives a true signal of safety and recovery. Blood pressure, in that sense, becomes less about fitness and more about accumulated tension that never fully powers down. Number 4. Visceral fat at normal weight. Here is a detail that surprises many women. You can wear the same clothing size you did years ago and still experience metabolic changes that affect blood pressure. There are two primary types of body fat. The first sits under the skin. The second surrounds internal organs, particularly the liver. This deeper fat, known as visceral fat, behaves very differently. It is hormonally active. It releases inflammatory signals and interferes with insulin communication. During perimenopause and after menopause, fat distribution often shifts toward the abdominal area, even without significant weight gain. This is driven by hormonal change, not lack of discipline. A woman can remain lean overall and still accumulate enough visceral fat to influence metabolic signaling. When visceral fat increases, insulin levels tend to rise more easily. Inflammation becomes slightly elevated. Blood vessels become less responsive. The kidneys receive stronger signals to retain sodium. None of this may show up clearly in basic lab work. Blood sugar may remain normal. Cholesterol may appear acceptable. Yet internally, vascular tone is gradually increasing. This helps explain why some healthy weight women develop hypertension despite maintaining an active lifestyle. The number on the scale does not always reflect the environment inside the abdomen, and blood pressure often responds to that internal environment first. Number 5. When the nighttime reset disappears. There is one pattern that often surprises women when we look at 24-hour blood pressure monitoring. Blood pressure is supposed to fall at night. That drop is not optional. It is built into normal physiology. While you sleep, the heart slows, stress hormones decline, and blood vessels loosen their tone. This nighttime dip gives the cardiovascular system a recovery window. When that dip does not occur, we call it a non-dipping pattern. The Ohasama study, one of the landmark ambulatory blood pressure studies, showed that individuals whose blood pressure failed to drop at night had a significantly higher risk of persistent hypertension and cardiovascular events. The key detail is that daytime readings alone did not tell the full story. It was the missing nighttime decline that predicted risk. In women, this becomes more common after menopause. Research published in journals such as Hypertension has shown that postmenopausal women are more likely to lose that protective nighttime dip compared to premenopausal women. Hormonal shifts influence vascular relaxation and circadian rhythm. If blood pressure never fully settles overnight, you wake up already starting from a higher baseline. Over time, that pattern can quietly become your new normal. Now, before we close, it is important to say this clearly. High blood pressure is not something to ignore, and it is not something to manage alone if readings are consistently elevated. If you are on medication, experiencing symptoms, or have other medical conditions, any lifestyle changes should be discussed with your healthcare provider. Nothing in this video replaces individualized medical care. Blood pressure is influenced by genetics, kidney function, hormones, sleep, stress, and metabolic signals. It is layered and complex. The goal is not to blame yourself or assume one single cause. It is to understand that numbers often reflect internal signaling, not personal failure. This is not about fighting age. It is about understanding how a woman's body evolves across decades. Healthy women can develop high blood pressure, not because they stopped caring, not because they lack discipline, but because hormonal shifts, sleep changes, metabolic signaling, and nervous system tone all interact beneath the surface. When you understand the signal, the numbers start to make more sense. You do not need to fix everything at once. Awareness alone is powerful.